In Indiana, listen to this, roughly 1 in 15 children is diagnosed with asthma every single year. The third week of September, historically known as Asthma Peak Week in the United States because of the increased number of asthma flare-ups. And that's this week. So we wanted to know more, and we're joined by pediatric allergist from Riley Children's Health, Dr. Klepfer, to tell us more about this. And first, I read that statistic, and I had no idea. And you said it's actually been it's been a number here for a long time. Why do you think that is? Do you have any ideas?
That's a great question. There's a lot of research into why that is. There's multiple reasons why people have asthma. Sometimes it's genetics. Sometimes it's a result of their environment.
Yeah.
And a lot of times it's multiple things all at once that are causing that asthma.
Well, we know then if it's that high that people watching this morning, they are dealing with it. They have children that are dealing with it. Why is this week the week in particular that we need to kind of talk about?
Right. So September is the time of year where we see asthma flare. So especially with children, we start to see them coming into our ERs, into the hospital, into our clinics, and parents are calling into clinics telling us their kids are having asthma exacerbations. The reason for that is they've been in school now for several weeks and they've spread their viruses to one another. And so now the virus is triggering their asthma. If they have any kind of allergic component to their asthma, so things like ragweed allergies, and ragweed is blooming right now, as are all the other weeds. So that also causes them to start to have asthma exacerbations. If they're going to school and they're on a school bus, sometimes just the fumes from the school bus can trigger asthma. Things inside the house now, as people start to move inside, as it gets a little cooler, things like pets, dust mites, all those things can just lead to asthma exacerbations.
So much. Can we talk about those symptoms and then when it's something that they need to go to the ER? I know that there are parents that want to, be safe, but then they're thinking probably about cost, and then they're thinking about, well, should I go to the ER?
Right.
When?
So we give asthma action plans to all of our patients, and we really push for all physicians to give their patients asthma action plans. So if they follow their asthma action plan, it's in the asthma action plan when it's time to go to the ER. So when they're needing their rescue medication frequently, if the child looks like they're in any kind of distress and having trouble breathing, then it's time to start to think about going to the ER. And we often put our numbers on the asthma action plan, so if any parent is ever concerned, they can call us first to get some advice.
Are there really good treatments out there? Any new treatments? Anything to make people that are out there that are stressed out about it, that's saying, you know what, there's more help even than on the way?
Right. So we really encourage people to see a specialist for their asthma, whether it's an allergist or a pulmonologist. There are really good treatments now available for patients with severe asthma. There's injectable medications on the market now that have made a big difference in patients' lives who have asthma.
Yeah. Is there that final message too for anybody watching that you could say, hey, if I could talk to everybody, here is like my piece of advice for you?
Well, because the asthma exacerbations are exacerbated usually by viruses, it's really the simple things: washing hands, trying to eat healthy, trying to get enough sleep, all those things we do, and we fail to do a lot of times, that then increase our chances for getting sick.
I think that, the easiest things, eating like real food and getting real sleep is such a big deal, but we keep, trying to do more. But so good to see you and appreciate you.
Thank you for the invitation.
Yes, you're welcome. You can go to fox59.com/links to learn more about the asthma program at Riley. Also find resources for Hoosier residents that might have asthma. Good to see you. Scott?